Welcome to Pharmative Live. I'm Dr. James Partyka. I'm your host. I'm a clinical pharmacist. I'm a cancer research scientist and pharmacist and the founder of Pharmative.com. And Pharmative is all about connecting passionate people like yourselves, patients, with healthcare professionals and scientists in order to educate ourselves about practical matters pertaining to your healthcare and your loved one's healthcare as well. Pharmative Live is coming to you live from our PNN digital recording studios right here in Palm Springs, California. And we're sponsored by PNN Plus Health mobile app. We're all part of the PNN Media Group, which is a number of local and national brands, including Pride Nation Radio. This is our time to have an interactive healthcare session, approximately 10 to 15 minutes long, in order for us to, again, discuss some practical information about managing your healthcare. I want to shout out to Helen out there. You're the first one to sign in. This is a live broadcast, so please feel free to text your comments or messages as we continue forward in this live interactive session. You can also send your questions to info@pharmative.com. Today we're going to be talking about a very common ailment, mild heartburn, and how you can best manage it with over-the-counter medications. Now, I promise you, within 10 to 15 minutes, you're going to learn something new that you never knew about antacids and H2 blockers for the treatment of heartburn. So please stay tuned. That's my tease for you to stay tuned. And today, Pharmative Live is brought to you by our sponsor, which is our PNN Plus Health mobile app. I see that John is also watching and Jimmy is also watching, as well as Angela. So I give a big shout out to you all here today. So I'm briefly just going to give you a tour of our PNN Plus Health mobile app before we begin our topic on heartburn, and just ask you, if you haven't done so already or later on today, download our free mobile PNN Plus Health mobile app at your Apple and Android app stores. And then once you download it, open it up, and it asks for an update. Just hit yes, and then you're good to go. And what's great about the PNN Plus Health mobile app is not only does it have great music, news, and entertainment, it also has other features such as access to your Twitter feed, Google searching, access to our contact information as well. But it also has a number of vital healthcare resource tools that we make all free and accessible to you 24/7 on demand. So now I'm just going to briefly go over the main menu, and then we're going to talk about our main topic for today. So this is what it looks like. Very easy to use, and nice, big, easy to read tabs, okay? And I'm just going to go very quickly through some of these tabs to point out features that you may or may not be familiar with. So the first and foremost would be Pride Nation Radio, which is the #1 dance music, LGBTQ music station in the country, Pride Nation Radio, as well as clubhitsradio.com. And that is the first tab. When you hit on it, you hear some really high beat music, which is not only great to dance to, but also to work out to as well. We also have a number of other music stations, including Pop Gay MTV with all your iconic favorite music videos, Musica 2020, as well as Hip Hop Jazz, which is a nice jazz station that you can do your work towards, relaxing and calming. In addition to that, we have a meditation channel called Meditate Now, which is great for not only meditation, but also great to sleep at night. And it uses technology which has actually been around for a long time called delta waves to kind of relax you, calm you, and put you to sleep. So check that out as well. In addition to that, we have a tab called Animal Kingdom, which is all these live webcams of various animals throughout the country, which I find interesting and fascinating to watch some of them. They're a nice way to sort of escape from all the stress and anxiety we're all experiencing today. We also carry Sky News Live for international news. We have a talk radio station with Alan Edwards. We also have a LGBTQ live streaming station called Proud TV Streaming. And there's a lot of vintage film footage from Palm Springs and a number of other areas throughout the country. In addition to that, we have Ask Pharmative, which is our social media content of pharmative.com. That you have direct access to, as well as Pharmative Live, which contains all of our library of not only Pharmative Live videos, but the videos we've produced on various healthcare topics. So please check that out as well. Then we have information coming to you from the CDC, trending health from the National Institutes of Health, cancer care from the National Cancer Institute, World Health from the World Health Organization. These are all very reputable sources of information on various healthcare topics, all for you to use as a resource for information. Very easy to use. Just hit the tab and it streams it up very quickly, very nicely, and then you select the topic that you're interested in. This is also a great way to get information about COVID-19 as well. We have a virtual chat bot which provides you a symptom checker called Doctor Symptom Checker. And so when you click on that tab, it'll ask you a series of questions and you tell the chatbot your symptoms and will come up with a differential diagnosis which you can discuss with your healthcare team. In addition, we have Find a Clinical Trial for those people that are concerned with their diagnosis and treatment and are searching for a clinical trial. You can certainly go to clinicaltrials.gov, or you can just go directly into your PNN mobile app and it'll pull it all up, and then you type in various keywords that will search for clinical trials in your neighborhood. We also have another tab called Find the Low-Cost Drugs in Your Neighborhood. We all know that medications are costly and sometimes your insurance may or may not pay for them, which I don't really understand, because if you have insurance, they should pay for them, especially if it's improved labeled indication, they should pay for them. But oftentimes, sometimes they don't, or some people don't have insurance. So you can go into Find a Low-Cost Drug, and not only will it find the lowest cost drug in your neighborhood, but it might also provide you coupons that you can use and have substantial cost savings for your prescription medications. In addition to all of those healthcare resource tools, we also have movies on demand. We have our online magazine, Pride Nation magazine, pridenation.com. Full access, easy to use, lots of interesting information. You can also access all of our PNN movie channels, TV channels, music channels, all from a touch from your mobile app. And then just to make it very user-friendly, we have things to do in Palm Springs, as well as a Palm Springs map. We have What's Up Twitter for your Twitter feed. We have games. We have events. And we also have even weather, Google search. You can create your own profile. And of course, you can learn more about PNN Media, all from one app. I love the app. I know if you try the app, you'll love the app too. So that's our mini infomercial today. Hi, Martinez. Thanks. Give you a big shout out. Now we're going to talk about heartburn. And I promise you're going to learn something in 10 minutes, something you never thought of before. Please, again, text me, me your messages or send your questions to info@pharmative.com. So we're all very familiar with mild to moderate heartburn and that burning sensation we feel in our food pipe, generally after a spicy, salty meal that doesn't typically agree with us, which occurs approximately 1 hour after our meal. And this is all related to acid and bile reflux from your stomach up into your food pipe, where it stimulates and irritates the mucosal lining in your food pipe. But there are other causes besides a meal that doesn't agree with us. It can be a mechanical problem with your food pipe, as well as an irritation, an ulcer that occurs in your stomach or in your small intestine. There can be an inflammation of the lining, and even a loss of the muscular tone. There's a sphincter which blocks that acid reflux from going up into your food pipe. And if that sphincter is not, constricted enough, then that acid and bile might come up and give you those feelings of heartburn. So if the heartburn persists, then it's time to see a doctor and to get yourself checked out for not only the common cause of heartburn, but also other causes as well. Medications can cause heartburn, and a very common class of medications are the nonsteroidal anti-inflammatory drugs like aspirin and ibuprofen. Aspirin is actually directly irritating to the mucosal lining, as well as ibuprofen, and it's important to take those medications with food to prevent that irritation. But even if you take a multivitamin or iron supplements, those are also very irritating to your mucosal lining, which can provide you symptoms such as that irritation feeling, as well as that acid reflux feeling that you get when you experience heartburn. Other medications include antibiotics, chemotherapy, as well as analgesics like opioids, Vicodin, which is basically very irritating to the stomach lining as well and can cause irritation. Conditions such as pregnancy can be associated and cause heartburn, as well as other types of diseases like scleroderma, as well as motility problems with your intestines, as well as peptic ulcer disease. So again, if the heartburn is persistent, you definitely want to see your doctor. First and foremost, before we talk about medications, we're always going to think about what are the non-pharmacologic ways that we can manage heartburn. And first and foremost is modifying their diet. Everybody loves spicy foods, but we know that some of us are very sensitive to spicy foods, so avoid them. Avoid salty foods as well. So modifying our diet would be the first step. Second, some of us who have some weight on us know that if we get back in shape and lose some weight and get exercising, we would experience less problems with our stomachs and irritation of our mucosal lining, and therefore minimizing our risk to developing heartburn. And finally, we get a little bit, because a number of us are taking medications and vitamins and supplements and so forth, get a little lazy in how best to take these medications and vitamins. But basically, you should, sit up and take them with a full glass of water and read the directions on the package, whether you should take them with food or not with food. But the water is important to basically provide the medicine from leaving your food pipe and entering the stomach and small intestine, where it is then absorbed. So again, take your medication as directed according to the package insert, and minimize your risk of developing heartburn. So let's talk about over-the-counter medications, and there are many, but they fall in basically three categories. And the first are the antacids. The antacids, I'm talking about Tums, generic Tums, calcium carbonate, or the liquid formulations as well. Amphigel, Maalox, there's a number of different products. Now, it's important to remember that these are medications and they do cause side effects. Remember, we've talked about this before. All medications cause side effects. So you really only want to take them as needed. For example, calcium carbonate, calcium causes constipation. So if you take too many generic Tums, you might have a problem with constipation. Some of these products contain magnesium. Magnesium causes diarrhea. So again, if you take too many of these products, you may have a problem with diarrhea, which then can cause electrolyte abnormalities. So again, take them as needed. And if your heartburn is persistent, you need to see a doctor or a GI specialist to see if there's something more of a medical nature that needs to be taken care of as well. All right, so I recommend, as a clinical pharmacist, as my antacid of choice, which provides you short-term relief, calcium carbonate. And I recommend not to use any products that contain aluminum, just because aluminum is not a natural element to be taken systemically into your body. And it makes much more sense to use calcium-containing products or magnesium-containing products. But overall, I recommend generic Tums calcium carbonate. The second class of agents are the H2 blockers. You'll know these by their brand names. Pepcid, the generic name is famotidine, or Tagamet, the generic name is cimetidine. And these actually block acid secretion to the stomach. So the first category, antacids, neutralize the acid. It actually creates an acid-base reaction, and you produce salt and water. When you take a product like Tums, with the hydrochloric acid that's in your stomach, you'll produce salt and water and eliminate the acid or reduce the acid in your stomach. The second product, the H2 blockers, generic Tagamet or generic Pepcid, actually block the acid secretion into your stomach. Now, the major advantage of these agents is they're very well tolerated. They have a longer duration of action, usually up to 12 to 24 hours. The disadvantage is it takes a longer time for these drugs to work. So there are products that combine the two together, and you may know them as a product called Pepcid Complete. It also comes as a generic, which I recommend because it's just as good as the brand, and it's usually a lower cost. So generic Pepcid Complete, which has an antacid and famotidine, the H2 blocker. So you get immediate relief with one tablet, and then you get sustained relief by the presence of the H2 blocker, the famotidine. So again, that's a very good class of drugs to use. I recommend famotidine over generic Tagamet. The generic name is cimetidine, because cimetidine and Tagamet is associated with drug interactions associated with blocking liver metabolism of certain drugs. So to me, Pepcid is just a better tolerated drug with less drug interactions and has a nice sustained duration of action. So again, choose Pepcid over Tagamet, use buy the generic, and if you're looking for a combination product, I recommend generic Pepcid Complete. Now, the final and last class of drugs are the proton pump inhibitors, which I would recommend them as a last resort for moderate to severe heartburn, and I'll tell you why. These are marketed under the brand names of Prilosec, Prevacid, and Nexium. And these are very potent, what they call proton pump inhibitors, PPIs. They're very potent. And you should not be on these medications for long periods of time, greater than 2 to 4 weeks. You should not be taking them for long periods of time because of their side effects, because of the problems they have interacting with other medications as well. So again, if you're on these medications for long periods of time, that's another sign to go see a GI specialist with regards to your problem with moderate to severe heartburn. They are very effective drugs. They're very potent inhibitors of acid secretion into your stomach. Now, one of the drug interactions I want to make you aware of is they're so potent, they prevent other medications from being absorbed. All right, this is actually a common problem that a lot of people don't even know about. So if there are medications that you are taking for chronic illnesses, you really need to check the drug interaction tracker at drugs.com or on your PNN Plus Health mobile app, because these proton pump inhibitors are so potent, they prevent a lot of medications from being absorbed. Many medications require some acid to be absorbed. And since these agents are so potent, I would recommend for mild to moderate heartburn to go with a drug like famotidine as opposed to going with a drug like Prilosec or Prevacid or Nexium, because they are so potent. They're excellent drugs, though, if you have peptic ulcer disease, but you should be taking that under the direction of a physician or a GI specialist. And they should only be used for the short term. And by short term, I mean 2 to 4 weeks, not longer than 8 weeks, under the direction of a physician or a GI specialist. They also have a problem with inhibiting drug metabolism and, like I said before, drug absorption. So for mild to moderate heartburn, I recommend first the non-pharmacologic manners, changing your diet, right? Lose some weight. Be careful of certain medications like benzodiazepines, Ativan, Xanax. They can basically relax that sphincter between your food pipe and your stomach, which will allow acid and bile to basically affect the food pipe lining and cause heartburn. So medications like that, you want to minimize medications, only take medication when you absolutely need to. You have to really think about what medications you're taking on a long-term basis. And you certainly want to minimize the number of medications you're taking, because the more medications you're taking, the more likely you are to have side effects and drug interactions. So try the non-pharmacologic methods first. And then secondly, if you need immediate relief, take generic Tums. Stay away from products that contain aluminum. And then for more sustained release, I recommend famotidine because it has less drug interactions than a drug called Tagamet or cimetidine, so Pepcid. And then there is a combination product called Pepcid Complete, and it also comes in generic. Again, I recommend generic, just as effective and decreases the costs. So that's our 10 to 15 minute talk today on treating mild to moderate heartburn. I wish you all to stay healthy, because it's easier to prevent disease than to treat disease, and we'll see you next week.